Hello again, Facebook, and welcome back to another Facebook Live with us here at the Plastic Surgery Group. I'm Terry.
I'm Joyce.
And today we are being joined by Dr. Williams and one of his wonderful patients who was so sweet enough to agree to come in and help us out today with this Facebook Live because we're talking all things tummy tucks.
So this is super exciting for us, especially me. I've actually had a tummy tuck, and I actually had it with Dr. Williams. Best thing I've ever done, short of having my kids. They kind of left me a wreck, and all those mothers out there that bounce right back and don't have a stretch mark or loose skin, hallelujah, be grateful. But for those of us that do, it's something that you kind of fight with, looking for bathing suits.
Yes.
And low-rise jeans and everything of that nature. It's just difficult. So, this is an answer to a prayer. And we're going to show you some pictures of her before and after that I think will really be a
They're fantastic.
surprise. Yeah.
Yes.
It's one of those things you can conceal it, you can hide it, but it bothers you. It's hard to look for clothes and everything else. So.
Especially during swimsuit season.
But rather than me sharing my story, we thought it would be great for you to actually get a non-bias, because we are a little biased around here. So I'm going to turn this over to Dr. Williams and let him talk a little bit about the process.
Okay. First of all, thanks for coming in. I think that, as we spoke before, I think the decision to have an abdominoplasty or have any kind of body contouring procedure probably has to be one of the most anxiety-provoking decisions that you've ever made in your life. Mm-hmm. Not only is it going to affect you and perhaps your health, but it's going to affect everyone around you, family, children, and that sort of thing. So tell us a little bit about the decision that you had to come to have an abdominoplasty, and you can tell us a little bit about the consultation, but also what were the factors that led up to you seeking consultation?
Well, with my first pregnancy, I gained a lot of weight, more than I should have, and I gained 60 pounds, and I had a 9-pound daughter. So I had a lot of extra skin and a lot of stretch marks, and I had 2 other children after that, 3 C-sections later. My stomach was a mess. And so after Megan was born in 2005, I always wanted to have a tummy tuck after that. I just knew that that was something that I wanted to do. And in 2018, January, I started the weight loss process. I lost like 30 pounds. And in June, I just decided that I was going to reward myself for the hard work. And I started looking around at area plastic surgeons and came to you and met you and decided that after the consultation that it was something that I felt comfortable with you. I felt like I could trust you, and I decided to make that leap and schedule my surgery for December, and it's the best thing I've ever done, really, truly.
Refresh my mind, how old are your children?
They're 19, 17, and 14 now.
Okay, so for a number of years you would go to the pool, and particularly you were probably very self-conscious of your appearance, things of that nature.
Mm-hmm. One piece.
And it probably affected how you interacted with others even sometimes.
Right, yeah, okay. Absolutely.
All right, so you come in for the consultation. Were there things done or said during the consultation that helped you arrive at the decision? Mm-hmm. And was anything that we did that was very helpful for you to understand how you get from where your appearance was to where you were going to be?
I think just the way you explained it and told me like what the expectations would be, that for 2 to 3 weeks I would be uncomfortable and in pain, and explain the pump, and it sounded like it was something that I could get through, and with family support, and I did. It wasn't like super easy, but it was something that was definitely doable, and I would do it over again just to get the results that I have.
So during the consultation, I like to draw some pictures, and
yes.
I try to spend a lot of time helping you understand just how we go about doing the procedure. And one of the things that I like to stress to people, there are 3 elements to performing an abdominoplasty, and we have to evaluate, as a plastic surgeon, we have to evaluate skin excess, fat excess, and in your situation we knew that there would be some muscle laxity because of the C-sections and the weight gain and things of that nature. So those all affect our decision with any patient, not just you, as to how we might advise them. For example, there might be certain patients who are candidates for a lesser procedure such as a mini tummy tuck and then some lipocontouring of the abdomen, both in the upper abdomen and on the flanks and the hips. But we felt that you were a very good candidate for that, And in fact, I have some pictures to show everybody, and Sarah, if you want to walk
Yeah.
over. So what we did at the consultation, and I think was helpful and,
Put that up there so she can really
and
go.
instructive, is to look at all the skin excess that we have up in the upper abdomen. And that skin excess is going to be literally displaced into the lower abdomen as we remove some part of the skin and fat excess of the lower abdomen. And not that you're overweight, but you just had some problems centrally, mostly from those pregnancies, okay? And so what we often talk about is try to explain to patients where their incisions are going to be, what it's going to look like. And it's very difficult sometimes, even on computer models, but even in a two-dimensional picture of doing that. So what we often do is we say, okay, we look at where your inguinal crease is, and that's where they are, and then there's going to be an area just about like this, an area just about like that, that's going to be removed during the course of the abdominoplasty. And so, and we typically go right below the C-section scar. That's where the lowest incision is. And so we like to talk about this being point A, and then point B is down here. Well, A goes to B, and that allows us to expose the entire abdominal wall, repair the muscles, bring the skin, and flatten the skin to the point to get you the result and the appearance that you want. And you can see her result has been very good, and we pretty much accomplished all those things. People will often ask us, well, is that a new belly button? No, that's your old belly button. And it's just that all the skin has been moved around it, so the belly button gets popped back through and that sort of thing.
Your results are amazing,
Fantastic.
and they fit that beautiful face. So I'm
Thank you.
thrilled for you that you're back to that 18-year-old body, huh?
I am so happy.
Yes.
You-
So pleased.
You talked a little bit about your post-operative experience, and I think one of the most important things that we as plastic surgeons can do during the course of the consultation is set those expectations, because your entire family is affected. You have a spouse that needs to understand that they're going to have to be around a while, and they're going to, and before you can resume or reassume your activities of daily living, which is taking care of a family and doing all the things that you need to do, you need to have some help, and you need to have some people who are around to help you. So we often talk about 2 or 3 days of pain pills, 2 or 3 days of getting off pain pills by stop day 5, 6, or 7. For the most part, you can get to the point where you can help yourself, prepare meals, things of that nature. You did have a pain pump, and you mentioned that, and I think that pain pump is probably helpful.
It was very helpful.
Okay,
Yes.
all right, very good. And then somewhere around day 10 is typically when you can resume most of those activities of daily living. No workout routines, obviously.
Right.
But is that a fair estimation, or did we set those expectations appropriately?
That's a fair estimation. I mean, I was still a little sore after
Sure.
day 10, but it's major abdominal surgery, so.
And for a while, you walked around just a little bit bent at the waist,
Just a
and
little
then
bit,
it takes some
yeah.
time for you to assume a more of an erect posture, correct?
That's right. And the girdle that we wear afterwards is very helpful, just to help you feel supported and.
That gets to be a hard thing to give up once
Yeah,
you're
it
used to
does.
that
It
support
does.
on your abdomen.
So there's there's some modification in your activities you have to deal with,
Right,
and for the most part, you overcome those very well.
I did.
And,
Yes.
and the majority of patients do overcome those difficulties, and that includes wearing the garment for an appropriate period of time. That garment can be hot and uncomfortable sometimes, particularly when you realize you're doing well
Right.
and you want to get rid of that garment, but sometimes that garment has a purpose. We do step you down to a Spanx, and I think at some
Right.
point we did that.
Yes.
Okay.
And I still wear that when I work. It just, it helps.
Okay, all right, very good. Well, again, thanks for coming in.
Yeah.
Thank
It's
you
very
so
helpful.
much.
Pleasure,
We
my
really
pleasure.
appreciate
It's
it.
very instructive, it's very educational for our patients.
Yeah, we learned a lot
Thank
about
you so
tongue
much.
today.
Definitely.
Yeah,
I think there's
I'm so happy.
You're welcome.
There's nothing like getting somebody's perspective dealing with it firsthand. My experience was a little. I mean, I came back to work a week later, but I think psychologically for me, I knew where I was coming from, and I was so excited. I said, had I had my gallbladder removed, I probably would have taken a lot more time to
Yeah,
recover.
yeah.
With this in my mind, I was like, I'm looking good.
Right.
So it kind of really helps your recovery, but to know that everything's looking great and back to a younger state, pre-children.
Right.
Right.
So thank you so much again for coming in. We certainly appreciate it, because we can
Thank
say
you.
all day long how great we are, but it certainly helps to have somebody like Kelly to come in
Non-biased.
and explain the process. Yes. So once again, we're gonna ask all of you to please like and share our video, spread the word on how fantastic we are here at the Plastic Surgery Group. But just as always, if you leave us a comment down below, you have until this Monday the 24th, until midnight, to leave us a comment, and you will be entered in a drawing to win a diamond hydrofacial,
Ooh,
which if you
good
haven't
stuff.
had it, it's amazing. So,
Amazing.
yes.
Yes. Thank you.
Thank you guys. Dr.
Yes.
Williams, Kelly, thanks
Thanks,
again.
everyone.
See you next month.
See you next time.
Bye-bye.